Hello, everyone. It's May 22nd on Friday. Before I go any further, I surely want to wish everyone a really happy Memorial Day weekend, and hope you're able to share some time with your family and your loved ones, and also I hope, and I'll get to this in a few minutes, but I hope you share some time with those that we've lost that gave us everything they had in life. And but before I get to there, I want to recognize that we lost another person, a 73-year-old female in Jackson County. That's our 71st death. And we've also lost a couple of other people. We lost a worker at the William R. Sharp Jr. Hospital that passed away. I think, from what I've been told, that this is a 54-year-old male that had complications from COVID-19. I do not know if he has been included in our total death numbers, but we've also, in addition to that, we lost an emergency services manager, or an emergency manager. He was from Barber County. He was, and he passed away after a short non-COVID-19 related illness. He was 46 years old. So we've lost a 46-year-old, a 54-year-old, and a 73-year-old lady. Two of these were COVID-19. One of them, I don't know exactly why, and that was the younger man. But I'd ask you, especially at this time, Memorial Day weekend, to have them, as Kathy and I will, in our thoughts, our prayers, thinking about their loved ones and thinking about the fact that their families are grieving in a big-time way right now. So we hate it, and they'll not be forgotten. Now, I want to go to a situation in the Eastern Panhandle that we talked about yesterday. I'm really proud, really proud of what we did. We kind of paused, we got numbers, and those numbers were alarming. Those numbers were alarming to our health professionals and the people that we call on as our experts all the time, and they truly are. They came to me and they said, "Governor, we need to go on this and go right now." You see, what I want us to always do, and this is what we have already done over and over and over, overreact. That's what I want us to do. We sent the National Guard up there. We went through all of the stuff that we could go through. We listened to Senators, Blair and Rucker and Trump, and a lot of different input from the health professionals on the ground up there. We convened a call with everybody. The doctors weighed the situation all amongst themselves. We had done an incredible amount of testing, and the net of the whole thing is everyone, at least at this time, and we're going to continue to watch Berkeley and Jefferson County and watch them very, very closely because of the exposure to D.C., but everyone concluded at this time that things are okay. Things aren't high alert, and things are okay. Our National Guard reported back exactly the same. And so the net of the whole thing is we want to continue in Berkeley and Jefferson County to know that is a high exposure potential area, and we want to continue to wear our mask as much as we possibly can. We're not going to make it mandatory at this time, as we move forward and everything, but I would highly encourage everyone, to continue to wear their mask when they go in buildings outside of their homes, and really try hard to just do exactly that. Now, again, I commend our National Guard and our local health officials and all the people that have that put in the licks and everything, and enabled us to be able to come up with more data. Now, again, I always want to be the one that is running to the issue, and that's what we did exactly right here. Now, if I can just talk just a second about this. You know, I've always just talked straight to you, and I've always just told you point blank the truth. Now, I want you to understand, and I want you to know, just from what we did yesterday, you know, we don't overreact from a standpoint of action. I want to overreact from the standpoint of knowledge. Now, there's two issues here that we absolutely are handling or balancing all the time. The first one is the pandemic, and the second one is the economics of the whole thing. Now, I have said it over and over and over. Just think, West Virginia. You were probably the first to restrict visitation or eliminate visitation at nursing homes. Maybe you were the first in the nation to test every nursing home, resident and all the staff. You were the first in the nation to do the same thing on the assisted living. You were the first in the nation to have a National Guard with a mobile testing unit. It just goes on and on and on. But yet, at the end of the day, we could have done all that stuff right here. And if you, West Virginians, had not done the great work that you did, we would not have produced the numbers that we did. From the standpoint of the evaluation of the pandemic and the numbers, nobody will ever be able to argue what you've done thus far. Now, we know we've still got a ways to go, but what you've done thus far, the numbers are absolutely what I would call over and over and over the miracle in West Virginia. The miracle that has absolutely earned you the notoriety throughout this entire nation for what you have done. You, West Virginians. Now, it's dadgum tough to argue the numbers that we have produced thus far. Now, on top of that, now you've got the second part of the equation that is the economics. And I want to report to you about the economics. You see, I have known this all along. I have not brought this to you right off the get-go, but I have known this in my heart all along. Our revenue people, I told you yesterday I was going to meet again with our revenue people, and I did. The numbers, and I told you, yesterday that the numbers continue to become in better than really what we thought the numbers were going to be. Now, the we is our revenue people, and our revenue people were presenting me numbers in the beginning that said, in the fiscal year that we're in, that ends June the 30th, we're going to be $500 million upside down. Now understand, the $200 million of that is when we shifted over the income tax into the next fiscal year that went from April 15th and to July 15th. And so just lay that aside just 1 second. That $500 million, then all of a sudden it started to change to $450, and then it started to change maybe even to a little bit better. And yesterday, we're looking at sales tax dollars that are coming in. We're looking at all kinds of different things, and literally the numbers keep coming in better and better and better. And the reason for that is really just one thing and just one thing only. We shut down the things that we had to shut down in West Virginia, but we really, for all practical purposes, never really shut the entire engine off in West Virginia. From the standpoint of manufacturing, our roads and mining and on and on and on, we continued to work. We let people work at home, and the numbers keep coming in better and better and better. So yesterday, now the numbers have dropped from 500 to possibility of even as low as 350. Now that is amazing from the standpoint that you got to remember 200 of that is the tax move. So all of a sudden the numbers keep getting better and better and better that you, West Virginians, are doing. And as we continue to reopen more, we should see the numbers start moving even better. Now, what does that really mean? And what that means is just this. Again, from the economics of the whole thing, I've told you from day one that the government was going to ease their regulations and their guidelines and enable us to recoup dollars from this terrible pandemic and try to backfill, or not backfill necessarily, but make us whole. Now, the cities are trying to, and the counties are trying to make applications right now. And as they're trying to make these applications, they're finding that the guidelines are enormously strict. I've told everybody over and over and over that at the end of the day, the government would allow us to backfill revenue, or the government would allow us the easing of regulations and guidelines that would enable us to recoup back dollars. Sure as the world. Yesterday, they came with a new set of guidelines. The new set of guidelines will absolutely help our state phenomenally. From the standpoint of, emergency workers or state police or DHHR, all these people, it will absolutely help us tremendously. But you know what else? It's going to really, just one and the same, be able to help our counties and our cities unbelievably. And we're not done yet. We're not done. There's going to be more to come. And the more to come is going to come from the possibility of backfilling revenue. You see, this is right in my wheelhouse. I am on the phone constantly with our president. I am on the phone constantly with the people in D.C. I know this stuff, and I know it up and down one side and down the other. Now, I truly believe, as I've told you many times, the economic end of this thing is going to be okay. It doesn't take away from the one person or several that would maybe be out there that were awaiting an unemployment check, and the bottleneck caused us a problem in getting them that. I absolutely understand that with all my soul, and we have tried beyond all comprehension to make sure that that gets done, and it gets done as expediently as anybody could possibly have pulled it off. Now, but from the standpoint of the whole is just this. I had to make sure in my mind, and I still don't have any assurances beyond belief, but it is happening. The numbers, follow the numbers. The numbers are getting smaller as far as the amount of dollars we're going to come up short. And as the numbers get smaller, it means we're doing better as West Virginians again. And as the numbers get smaller, and I tell you that there's going to be guidelines that are going to be issued that is going to give us more freedoms, and they do, the numbers get even smaller. Today, right today, as those numbers get smaller and smaller and smaller, we're going to realize that West Virginia is doing good stuff, and West Virginia is going to be fine. Our counties and our cities are going to be fine. And there is lots more that is going to happen right around the corner. From the standpoint of the pandemic that is out there, our great people and you, West Virginia, are producing numbers beyond belief. We're going to continue to run to the fires everywhere. We're going to continue to overreact until we obtain additional knowledge. We're not going to act until we have knowledge. And knowledge we got yesterday right there in Berkeley and Jefferson County. Now, I want to just ask just this, and this is one thing that we have got to do. From the standpoint of opinions, we absolutely welcome all. We welcome all types of different ideas. From the standpoint of working with the legislature, we're getting ready to put together a plan that would enable us to all, have advisors and work on a committee together on dollars going out or all kinds of different things from the standpoint of monies. From the standpoint, of working together from the standpoint on this pandemic, whether it be the local health officials or whomever it may be, we're all in. We are constantly soliciting information and knowledge. But the one thing that I can't stand is just this. It's just somebody over here on this side that believes no matter what in the world we ought to do, we ought to never shut down anything. We ought to never take any precaution. For God's sakes, a living, really and truly, at the end of the day, they faked that lunar landing in the first place, and they're faking this too. We don't need to hear that. That's nothing but garbage. We don't need to hear that. We know what this killer's all about, and it's everywhere. And on the other side, we really don't need to hear all the noise that says, really and truly now we're opening up swimming pools, so we're going to kill 19 other people and everything. We got to know we don't need that noise either. It's not, those aren't opinions. Those are soapboxes for somebody to get some level of notoriety. I can't stand that. I can't stand that because in this situation, West Virginia, you better know that you got a governor that is no way has done anything from the standpoint of politics. This is all there is to it. This is too dad blame serious. That's all there is to flat to it. It is absolutely, it could have put our state into a financial burden like nobody's business, and we could have died like flies. Now, you keep doing the good work, West Virginia. Push the noise away. I'll continue to push the noise away. And the only other thing I would tell you on this is just this. We're going to convene next week. We'll do it virtually. But we're going to convene next week every single county official, health official and everything that can get on the call and help us with more and more and more knowledge. These aren't grandstanding. This is knowledge of people that continue to produce more and more and more knowledge so we can do better and better as we go forward. You see, at the end of the day, we're not done. We're not done. And we continue to solicit more and more information and more knowledge so we can do better and better in answering and supplying the guidance that we need to do. This is not an easy job. We have pushed a lot of the right buttons, but we still got buttons to push, and we're going to continue to work, and we're going to solicit and bring in everybody, as we always have, to continue to do this and be completely transparent with you. But at the end of the day, West Virginia, you've done great, and I just want you to keep on doing it. Now, I've got a few things to go through real quick, but I'm really happy about Berkeley and Jefferson counties, and we're going to continue to monitor and keep going and know everybody know right there that is an absolute danger zone from the standpoint of their proximity to D.C. Boy, this one's tough. This one is really tough to me. Anyway. Yesterday, one of our media reporters made a disparaging comment on Twitter about one of our general services custodians. I don't get it. I don't get it. It's just, why do we think this is a game? I mean, why do we think really and truly what's going on here is just a game? It's not a game to these families that I went through with earlier. It's not a game with what's going on, with somebody that could very well be losing their business or trying to figure out how to run a restaurant on 50% capacity. This is not a game. I mean, that's just all there is to that. But at the end of the day, our custodians that are taking care of this capital, is there anybody here more important today? Is there anybody that could be more important? I mean, the way they take care of this place is really keeping us all from getting a rampant situation, as far as this terrible disease. There's no place for that. There's just no place for it. And I'm really sorry. I'm really sorry that we've got to come up with stuff like that. It just doesn't make any sense to me. I want to talk about the free testing that's going to be going on tomorrow and the next day, or actually today and tomorrow, from 9 a.m. to 4 p.m. in 4 counties. And those 4 counties, I think, were Monongalia and I don't know the rest of the counties, so help me, Jordan.
Yeah, it's Monongalia, Cabell, Kanawha, and Marion counties.
Okay. Did that go up? Could everybody hear that, Jordan? Okay, well, good. Okay, well, anyway, that testing's going on. We especially encourage, our African American community to come out and be tested, because that just gives us more and more information. And the dangers from the African American community that we saw on a national scale. And so we want to absolutely make sure we get as much information as we possibly can. But it's for everybody. It's for anybody that just wants to be tested. Please come out and get tested, because it'll just give us, but the more testing we're able to do, the more and more information we got, and the better information just makes it better and better. One thing about our dashboard update from the beginning, we have been completely transparent about our numbers as the pandemic has gone on. We continue to have more and more data available on the COVID-19 data dashboard that will be dated today at 5 p.m. or updated today at 5 p.m. with lots of additional information. And Dr. Schlemp will give you some more details on that in a few minutes. Today, I have issued a proclamation ordering that all U.S. and West Virginia flags fly at half staff. And from today through Sunday, May the 24th, as a mark of solemn respect for all the victims of this terrible pandemic. And this just follows in suit with what our president's doing, President Trump. I encourage again all the counties and the cities to apply. You will have time for additional applications. Trust me on this. I know what I'm talking about. These guidelines are going to get better and better for you. It may not be a windfall. We don't want it to be a windfall, but absolutely we do not want to, sit there, with a situation where we've got great big holes in the bucket. So continue to apply. I encourage all of you to do so. And there may be small monies going out in the beginning because of the restrictions, but now you'll see that there'll be an opportunity to bring in significant more dollars to our counties and to our cities, and that's great news to me. Okay, Memorial Day. Memorial Day is coming, and the sun's going to shine, we hope, and we hope it's going to be warm. And one thing that happens, on Memorial Day that is tragic beyond belief, or over the holiday period, is we have boating accidents, we have swimming accidents and everything. I would thoroughly encourage everyone to wear a life jacket and, just enjoy yourself. But those life jackets are incredibly, incredibly important. I was watching a thing on the news. They were doing, a little thing, I think, on the Princeton Fire Department, and maybe it was even a volunteer fire department there, and I can't recall exactly who it was, but I think it was in Mercer County. But I'll never forget this guy that was talking. He said, of all the drownings that we've ever gone and gotten and picked somebody up that we've lost, we've never had one that we've picked up that had a life jacket on. So wear your life jackets if you would, and I'm going to read this thing here, and this is my last thing I'm going to talk about, right now, and that is, I have issued a proclamation today ordering that all U.S. flags fly at half staff from dawn until noon on Monday, May 25th, which is Memorial Day, to honor those who have given their last full measure of devotion on behalf of this country, and please, we want to do this in support of all those men and women who have served us with an unwavering devotion in our armed services at home and abroad. I also ask all West Virginians to observe the National Monument of Remembrance at 3 p.m. on Memorial Day. I want all West Virginians to know that there is no prohibition about, placing flowers at grave sites, and I encourage you, if you're able to do so, to pay your respects and do just that. So, the only last thing is our numbers, and yesterday we had a spike in one day of 3.1%. Today we've dropped back down to 1.4%. Great news. As far as our cumulative number, our number now has dropped from 1.92 to 1.91. Another bit of good news from the standpoint of our active cases and our recovered cases. You can see that they continue to move along in a really good way. So the net of the whole thing is just this: as we continue in West Virginia to reopen more, because I let you under the tent with real information that's coming from my brain and my heart, in that, you see, West Virginia, in many ways, there was a broad spectrum that were essentials, and we continued to work, but we did it. How did we do it, West Virginia? How in the world did you do it and pull off these numbers? You know how you did it? You're smart. You're really smart, good people. You're people that listen and people that absolutely know what to do and have great instincts of what to do. You did it. I mean, you did it. You continued to work enough that our economic numbers are not all that bad, and you continued in West Virginia to put out health numbers that blew the world away. Just keep doing it, West Virginia. Really proud of you.
All right, thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As the governor pointed out yesterday, directed us to review the matters in the Eastern Panhandle, engage with local health experts as well as our state health experts and the coronavirus team. We looked at a couple of key areas and have presented to the governor 4 lines of effort that we believe should be followed to continue to keep things moving in the appropriate direction. The first of those is broader testing support to the local health departments, particularly in the 3 counties in Berkeley, Jefferson, and Morgan County. We will see some additional changes. Dr. Schlemp and the Bureau of Public Health will be providing additional assistance in the way of additional materials to the local health department as they expand testing within the community. Will also be some coordination between those organizations with support of the National Guard to set up additional testing lanes going forward, and to go out in a concentric approach as recommended by Dr. Marsh to look at how it potentially expands out into the other communities. In addition to that, I believe Dr. Schlemp and the Bureau of Public Health will also be doing some additional testing as a result of case investigation that will continue to expand that level, and all that will be coordinated with the local health leadership. And the last area related to that will be begin to be some efforts to start antibody testing in those communities at the recommendation of Dr. Marsh and others. The second line of effort will be more surveillance and epidemiology support to the local health departments. Dr. Schlemp and the Bureau of Public Health have already been engaging on that, and will be using additional DHHR assets as well as some additional support from the National Guard. A couple other areas related to that piece of it. There'll be some additional National Guard support to the local health departments to help manage data, to include looking at positives versus recovered, as well as hospital data to make sure we stay on top of supporting our local health departments in those numbers and that analysis. And then Dr. Marsh has some folks at West Virginia University that will also be looking at what is referred to as the R0 rate, or the transmission rate data, working with the Bureau of Public Health to address that at the county level, so we have better visibility on that. The third line of effort will be additional support to the local health departments related to outreach, education, and sanitization support where needed in certain areas. And one particular area will be as businesses continue to open up. For example, restaurants, subject matter expertise will be provided by the National Guard to help be a force multiplier to the local health department to better educate the things that we need to do to continue to reduce the spread and the transmission rate. The last area will be due to a donation that was provided to us, the state of West Virginia, by the Haynes T-shirt company. We have some additional cloth face coverings that will be provided to the local health department for distribution to continue to encourage individuals to use face coverings and continue to reduce the spread and the transmission. I want to particularly thank Secretary Crouch, DHHR, Kathy Schlemp, Bureau of Public Health, the local health officials, Bill Kearns, Dr. Terrence Reedy, and Dr. Kevin McLaughlin for a lot of time and effort that went in over the past 24 hours to put this together and these recommendations to the governor to move forward. I believe what we see here in front of us now is a plan and a model that we will use going forward as we see other numbers in other counties as we continue to test. As of just a few minutes ago, from the National Guard folks supporting the Bureau of Public Health and the local health departments, we've seen a throughput of 837 people already today in the counties that we're providing testing support. And as was pointed out by Bill Kearns and the folks at the local level there in the Eastern Panhandle, the good thing that has come out of this is there were 35 individuals identified as positive who are now under the appropriate contact tracing and isolation activities, which helps further reduce the spread of the virus, is exactly what we were asked to do by the governor as we ramped up these testing activities and the contact tracing activities going forward. So again, I believe it's a model going forward. The last thing that we recommended to the governor and we'll continue to do as a state team is to continue to improve our communication efforts with our local partners going forward, so we can, as the governor pointed out, have that best information and data going forward to address issues. Thank you.
Thank you, General. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
So thank you and good afternoon. I want to reinforce what the governor and what General Hoyer have said. This is a new world that we're in. And as we start to focus on county level information, we are trying to harmonize our assessment systems to make sure that, as we see thresholds broken, even if it's on a single day, then we have a more comprehensive and well-communicated set of strategies that we can deploy back to those counties in concert with the local health departments, county health officers, and other officials. And I think that the Eastern Panhandle is really our first experience now in this new approach. And ultimately, we will continue to try to learn from every experience we have. Certainly, as we looked at the increased testing that we did in the Eastern Panhandle over the last week or so, we did see an increased number of cases. And as the general said, it's great because we were able to identify people who may have spread that to many other people. There's an article from the CDC that just came out that estimated that in their hands, about 40% of people that test positive for COVID are asymptomatic. And we've already talked about the pre-symptomatic group. So identifying these people and investigating their contacts and starting to really focus on local control is very, very important. Today, our R0 level at the state has gone up a little bit to 0.92. It's been in the 0.8 range up until today, and that may be another blip, but I think that it's really important to recognize that what we're trying to do is we're trying to take care of things very quickly and early, because as we have seen in other countries, in New York, et cetera, that the COVID problem, the spread, happens sort of silently for 10 to 14 days before it starts to surge. And we are very, very committed to working with the local health departments and county health officers to be able to identify these sort of movements forward so that we can take care of these potential problems before they happen. The only other thing I wanted to add is there's another article that came out from South Korea today that basically said that in health studios, if you have people that are infected who are yelling, screaming, this was dance instructors now, versus who may have been doing things more quietly, like yoga classes, that the infection rate seems to be much different. So I think as we are opening our health clubs and gyms, we just want to be cognizant that, again, trying to maintain good hygiene and maybe not yelling and screaming and singing in those environments would be good. And as the governor has said, and as we have talked about extensively, the use of face coverings or face masks up to 60% at the very least, but 80% being much more effective, will be a critical weapon that we have to enable us to navigate this part of the COVID epidemic, where we're going back out and living with the virus much, much better. So thank you very much.
Thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slip.
Thank you. Good afternoon, everyone. I will try to be very brief here. The governor asked us several weeks ago to really step up testing in West Virginia, knowing we were opening up and going to try to get businesses back up and get folks out in the communities again. We tested, as the governor mentioned, last weekend, 2 days, 2,300 individuals. Just want to mention that over the last 7 days, actually ending on the 20th, May 14th through the 20th, we tested over 14,000 individuals in West Virginia. So we are really pushing that issue and trying to see if we can get prevalence rates and see where this disease is. And we're training close to 300 contact tracers. So we're looking to really tackle this problem in a little bit different way than we have in the past, or a little more aggressive way. And I want to thank the local health departments and of course, the National Guard and Dr. Slimp and her staff who've really worked together to try to get these things done quickly. We've also added another component to that testing, which is our African American and Minority Task Force. So we're getting their input, trying to make sure they have input in terms of where we test, and trying to get good outcomes, a good turnout from African American and minority population. With that, the governor mentioned the dashboard. I am very excited to have this up and running at 5 o'clock. I just want to say to Dr. Slimp and her staff, she has some terrific staff who work day and night to get this done. We wanted to see county information, and everyone wants to be able to pull that up. I think everyone will be very pleased with that. Kathy will give you a little bit more detail about that website, the change on the website. That will be up at 5 o'clock.
Super. We really are excited about the really overhaul of the dashboard that you'll see this evening. As Secretary Crouch mentioned and the governor mentioned, one of the things we're most excited about is that county level data. So folks can really see what's happening in their county, look at the demographics, look at the testing information, look at probable and recovered cases and active cases, et cetera. So I think that'll be really helpful. The other changes that you'll see, it really address things that are changes in national definitions or in new technologies. So for example, we now are receiving serologic or antibody testing results. And the right way to follow those is to pull them out separately from the confirmed laboratory results there for the PCR results that we have. And so you'll see those pulled out separately as well. The second area you'll see changed is we are going to have data on both active and recovered cases by county. So you can look at that at a local level, which is great. That's the kind of data that places that like Berkeley and Jefferson and other folks can really follow what's happening in their own community. The third area that you'll see, or the fourth area, I guess, that you'll see is aligning us with some new definitions from the Centers for Disease Control and Prevention. And that includes addition of probable cases, which are cases that most likely are COVID-19, but don't have an actual PCR positive test result. And so we want to make sure we include those so we're capturing all of our cases. We handle those cases just like any other COVID-19 case. It is important to note that you're going to see a couple of one-time changes today at 5 o'clock. And just so you'll understand what happens there, you will see a one-time larger than usual increase of the number of cases by around 30 to 40, probably around 40 cases or so. And that's just the additional of those probable cases. And then you'll also see a one-time unusual decrease in the lab tests. And that's pulling out the serologic tests. So those will be one-time changes today, and then it should flow forward from there. So that's going to be the key things you'll see. I do want to do a real shout out to Amy Adkins and her team in the epidemiology office for their vision on the changes that we've made and their hard work in doing that. Also to Tim DeBar with our MIS staff, who really helped operationalize it and make it visible. And then lastly, and most importantly, to all those people who work tirelessly to collect that information and investigate cases and work with folks, because they really truly know folks behind the statistics, and it's the people that care and support them. So thanks so much to all.
All right, thank you both. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. First of all, I want to publicly apologize for what were completely thoughtless and completely insensitive comments on Twitter yesterday. Governor, as disappointed as you are in me, I'm probably 100 times more disappointed in myself for that behavior. And I agree with you that the custodians and general services workers here are the most essential of all essential employees in state government. My question regarding Berkeley and Jefferson, is it a factor of additional testing that caused this blip earlier in the week? I'm not clear on that.
Okay, first and foremost, I would say this. We all should recognize, it takes a big guy, big man to stand up, and say, when we mess something up, and so all of us should some way, somehow, have forgiveness in our hearts, and that's the right thing to do, in my opinion. But nevertheless, Phil, if you ask the question about the Jefferson Berkeley County, I didn't get exactly what the question was, but could you clarify that one, please?
Yeah, wanted to know if the blip earlier in the week was a result of the increased testing that's going on in those counties.
I think that's, there's probably some other little twists and modifications and everything, and General Hoyer and Dr. Slimp and everything could answer that. But that's the primary. That's the primary driver of the whole thing. Is we we went there, we tested lots and lots of people. We had a big jump in the number of positives and everything. And at the end of the day, what did we do? I mean, we continued to try to get more and more information. And I told everybody that we all know this, that those counties are sitting right beside DC. And we know there's more issues in Virginia and DC than there are here. And so we ought to absolutely still try to take heed and wear masks when we go into buildings. But really and truly, when those numbers jumped and they jumped the way we did, we ran to the fire. We sent the National Guard, our health officials, the county, and then after we got there and everything, we huddled everybody together. All the experts from there, the docs and the local health teams and all that. And then everybody talked through this issue and said, look, really and true, what we've done is we've tested a whole lot of tests here, and that's why we got the positives, and we ought to celebrate that we've got 37 or whatever it may be, people that we know have tested positive, and we can quarantine, or we can go through the contact tracing and whatever on that. So I think it worked out really good, but and I'm really pleased with the fact that how we ran to the fire, and then we didn't have to do anything. So that's really good stuff.
All right, thank you, Phil. Next, we'll go to Kenny Bass with WCHS.
Hi, this is Kenny Bass with Channel 8 and Fox 11. Governor, I know you've put June 8th as a tentative date for the start of Little League Baseball, Little League Softball, and maybe soccer. Number one, have you given more thought into that as you keep looking into the opening of our society and we get back? And number two, as a coach yourself, there are different aspects to baseball. Travel baseball is very big in the state, and that entails many teams from out of state either coming here or our players going to those states. So where does travel baseball fit into all this mix?
Well, Kenny, I would be a whole lot more hesitant about travel baseball. Just to tell it like it is, we have really, this weekend is a monstrous weekend because we are opening a lot of stuff beginning on Thursday the 21st, and we're going through this weekend, and then we had the situation with the positives that jumped up in Berkeley and Jefferson yesterday. And to just tell it like it is, I have not done any additional work on that. I know Kentucky and Ohio are starting to open up, as far as their little leagues and stuff for practicing. That doesn't mean that West Virginia needs to do that, but we'll continue to monitor this and give you those answers as soon as we come back from over the weekend.
All right, thanks, Kenny. Next, we'll go to Kara Lofton with West Virginia Public Broadcasting.
Hi, this is Kara Lofton with West Virginia Public Broadcasting. As things begin to open back up, I was wondering if Dr. Marsh or Secretary Crouch, one of you guys, Dr. Slim, could talk a little bit about grandparents. I know that a lot of grandparents really want to see grandkids as things are opening up, but obviously this population is still at high risk. Do you have guidance for families as summer gets on and, there's normally a lot of interacting between those populations?
Dr. Marsh, go.
So thanks for the question. Obviously, we still recognize that the virus is in West Virginia, and that we know that we have a very vulnerable state. In fact, the most vulnerable state by the Kaiser Family Foundation. But I think that the general guidance is really to do the things that you feel comfortable with. Ultimately, if grandparents and grandchildren are going to interact, or families interact that don't live together all the time, and where people in the different parts of the family are out interacting with a lot of other people, then we would recommend to be careful with that sort of coming back together again. And if you're going to do that, it would be good to wear masks if possible, and to separate, and to be outside versus inside. And I think that, we want people to be able to visit together, but we do want to protect our vulnerable population. And we know that people that are over 65 years old, particularly over 70, 75, are at higher risk for poor outcomes or poorer outcomes if they get sick from the COVID virus. And we also know people with pre-existing medical conditions, diabetes, high blood pressure, heart disease, obesity, all have more risk as well. So we would suggest that if people live separate and they come back together, then try to maintain your distance, hug virtually, and wearing masks, I think, is a really good idea, and being outdoors versus indoors. So that'd be the guidance that I would recommend.
All right, thank you, Kara. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, everyone. Happy Friday. It does sound like there was a rapid response in the Eastern Panhandle after last weekend's testing blitz. I'm wondering, though, about small town West Virginia. I'm wondering about towns like Berkeley Springs or Parsons, Chester, Franklin, Marlinton, places that may be off the beaten path but still affected as we open up. In what way can we know what the situation is in these small towns around the state?
Well, I think Secretary Crouch, maybe you can answer that. I can make a stab at it, but go ahead.
Yes, thank you, Governor. We are looking to do more testing throughout the state. We're looking at sites right now kind of in priority, but clearly these small communities, we have to get out and do some testing there as well. We don't know where hotspots are unless we test more. I mentioned we tested over 14,000 individuals in West Virginia in 7 days. We're going to stick with that. I don't know that we can go much more than that right now, but we're looking at even doing more than that in the future. But we want to go to some of those small areas. I have the list for 2 weeks from now, but I don't have that in front of me. We'll see if we can post those locations, because we are going to be moving around the state and doing more of this testing. So it's a good question. We have to look at these small communities as well, and we will.
I think it's also important to note that testing happens in many sources of communities. So while a large number of those individuals recently were from the large-scale testing, not all, and we do have cases being reported in a variety of communities around the area. So those are the things we will look at and we follow carefully.
And let me add one quickly. The testing we did for nursing homes, where we tested employees, and the testing that we've done for our daycare workers are really from a variety of communities throughout the state. So we are testing, but not through our program now that is free and doing the mobile testing. So we'll be doing more of that. But we have looked at all areas of the state that we tested this individuals in.
All right, thanks, Phil.
One thing too, Brad, along those lines too, we're monitoring any infections that we get, from the standpoint of especially hospitalizations and everything, and then God forbid any type of deaths. But if we see a situation to where we've got 4 or 5 people from the Marlinton area and everything, we would absolutely react to that in a really aggressive way also.
All right, excuse me. Thank you, Brad. Next, we'll go to Amanda Barron with WSAZ.
Checking my mic today. Hi, everyone. Amanda Barron with WSAZ. I wanted to ask, more and more businesses are saying they're not going to be able to open at 50% capacity because they can't afford to. So when will you guys, or what will determine when those businesses can open to a larger capacity so long as they can social distance? I know, for instance, there's a McDonald's in Huntington that can't open the lobby because they say it's just not worth it for them. So your thoughts on that? Thank you.
Amanda, I think the answer to whomever, and anybody can jump in if you want to choose to jump in, but the answer is just going to be, we just got to continue to watch all the numbers. The numbers will lead us. I mean, there's a real science in this, and the numbers will lead us. The numbers led us yesterday to Berkeley and Jefferson counties. The numbers will lead us as we go, and we'll continue to open up all we possibly can, because we all know that we have to reopen. We've got to get back to work, but you also know that you got a leader of the band here that's absolutely going to watch the numbers and absolutely try to protect you with all my soul. First and foremost, you can't imagine how much I hate like crazy sitting here and telling you we lost another person. So I am trying with all my soul to protect you in any way I possibly can. However, we know we've got to continue to move north. We've got to continue to try to reopen. And we've got to live with this. We just got to live with it until we can get a drug that'll make it go away forever. So I think, I commend everybody, but we just got to watch the numbers.
All right, thank you, Amanda. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering if you could be a little bit more specific about the planned call next week with our health department officials. What is the knowledge that we hope to get out of that we're not already getting from our daily communications from the local health departments and their reporting? Thank you.
Well, Charles, I think just this. What we're going to try to do is reach out to where we can get at least one person from all 55 counties. And then we're going to be able to put them all together where they can, teleconference with one another. I'm going to be there. We're going to try to, get everybody on the line and everything to where, we can just continue to do one thing, and that is just this. I mean, if we can save one person, can you imagine what a life is worth? None of us can quantify that. Really, if we can save one person, and so all of us to come together will just improve the communication and provide support for one another, and just that. It'll just make us smarter, and so that's what I want to do. Remember, let me just end by saying this. Remember, this is not over. I mean, we may not even be in the fourth quarter. We got a long way to go, and as we continue down the path forward and a long way to go, the more knowledge, the better. We just keep dragging in more and more and more knowledge, and we just keep getting better and better.
All right, thank you, Charles. Next, we'll go to Paul Mullen with WCBC.
Good afternoon. Good afternoon, everyone. Good afternoon, everyone. My question deals with social distancing and the use of a mask. Some folks out there believe that if you put a mask on, you don't have to socially distance. Can Dr. Marsh address that and the importance of doing everything as washing the hands, not touching the face, the whole package, rather than just putting on a mask?
Go ahead.
Very good for me to go?
Yes, sir. Go, Doc.
So thanks for that question. I think it's really, really important. So we know a mask is not a substitute for all the other things that we have done so well as a state to protect each one of us and protect our communities and our vulnerable population and our healthcare workers. And so a mask is an additional piece. So remember, as we talked about at the very beginning of this pandemic, that one of the really important things to do was to flatten the curve, to try to reduce that compounding spread, that rapid spread, exponential spread of the virus. And we did that by not only sort of having people stay home, but we also did it by people washing their hands much more frequently, which is good for a lot of different kind of infections, not only COVID, but influenza and other type of infectious viruses and bacteria, but also with staying distance, and that's 6 feet. And that's really based on some previous work where people within 3 feet of an infected group of people were able to be transmitted the kind of infections that transmit by droplets, which is what COVID does. And also not touching your hand, your face. We know that the virus can live on surfaces. It may, at this point, be less likely that that's the way it's spreading to a lot of people in the country, but avoiding your mouth, your nose, your eyes. But as we've talked about, now that we're coming back out together, we still want to follow those principles. And again, being outside is safer than being inside because you've got a much bigger volume of air to disperse any of these droplets that may be produced. But a mask keeps you from creating the droplets, from having the droplets stay airborne as long. Again, normal talking, droplets can stay airborne for up to 15 minutes. It stops the distribution, the spread of droplets, and it causes the droplets to go to the ground or stay in the mask if somebody is infected and doesn't know that they're infecting others. So a mask is an additional part. And remember, Sweden, which basically didn't close their economy, no mask, has a death rate of 38 people per 100,000. US, a death rate of 28 people per 100,000. Japan, that wears masks in addition to doing these other things, has a death rate of 0.61 people per 100,000. Japan has only had about 785 people die this whole time from this pandemic. So I think that it's clear that we need to add masks to our other armamentarium, not use it in place of. So really good question.
All right, thanks, Paul. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and everyone. Governor, in this, General Hoyer may want to chime in on this too, since it involves Workforce West Virginia. But the other day, I gave you folks 3 Facebook groups: WV Unemployment Discussion, WV PUA Discussion, and WV House Democrats. I've looked at the list they've compiled along with a Senate Democrat. The numbers I would gather, and there might be some duplication, but I'm looking at 1,000 to 2,000 names of people who claim they're still not getting benefits. My question is, has your office or workforce reached out to these groups on Facebook to try and get the data and try to get to the bottom of where these people are in terms of getting the benefits they believe they are entitled to?
Okay, let me start off by saying, I've reached out. I've reached out directly to the Democrats and got the list myself and forwarded on to others and everything. So not only are I'm sure the generals and the workforce and everybody working it, but I've reached out myself, and I think we're making some real progress there. The Democrats reached back to me today on a text and said, thanks for the marvelous work in regard to these 1,000 people or whatever that were still struggling out there. But anyway, maybe General Hoyer can jump in with that.
Yes, Governor. So, Mark, as the governor pointed out, there are legislators from both parties who are sending to Workforce West Virginia, to Scott Atkins and to Secretary Gaunch, individuals that they identify that are still having issues, and those continue to be worked on a regular basis. And I actually had one myself day before yesterday that came to me direct that I passed to Scott, and within 24 hours they had resolved it. As the governor points out, it's been a monumental task for workforce and commerce with the numbers that we've encountered, and continue to be glitches here and there, but I believe that folks are continuing to work hard to try to address those once they're identified. And I know the governor's continue to encourage anybody who has a problem to push that forward, so we know that we have a problem and that we can address it.
All right, thank you, Mark. We have time for one more. We'll go to Taylor Stuck with the Herald-Dispatch.
Hey, it's Taylor with the Herald-Dispatch. As we ramp up contact tracing, what should people who may be getting a call be prepared for? What would that sound like, and what kind of information should you be maybe keeping track of? Should you be keeping track of where you're going as you head out this Memorial Day weekend or things like that?
Dr. Slimp, this is you.
Certainly. This is a really important part of our response. And so when an individual is positive, they get a phone call from the local health department, and they have an individual that actually works with them to understand first how they're doing about their disease and understand that, and then who they've been with. And they typically follow that from 2 days before the beginning of symptoms until the present, to kind of understand who they might have potentially exposed. And so that's the first part of that case investigation. And then they do connect with those contacts to share. They don't give any information specific to the individual, but to share they have been exposed to someone and what the right actions are. It's often done by phone. You typically will get a phone call, and then they will introduce themselves. And we can go through more of that another day, which I'm happy to share with you further. But I think it's just an important, it's a personal connection that we make to help people understand what the situation is, give guidance, and go forward together. And it's really important that they work in partnership. And then also we link them into systems that will call and check with them every day to see how they're doing, to follow through. Thanks.
All right, thank you, Taylor. Governor, I'll turn it back to you.
Well, I really don't have many notes. You know, all I would say is just this. I was just scratching out a little note here to myself and everything, but you know, it's Memorial Day weekend, and I entrust, you know, that we'll have a lot of emotions through this weekend. You know, first and foremost, you know, those that we've lost, please keep them in your thoughts and prayers. Those that gave everything for this great country, keep those in your thoughts and prayers as well. And so those emotions, I'm sure, are somber and probably in many ways sad. You know, we'll have the emotions of, you know, seeing a child run through the yard and you know, all the happiness, you know, that goes on with sunshine and summer coming along, and we'll have the emotions of the goodness to our heart to be with our loved ones. So please enjoy this time and keep this time close to your heart, but just don't let your guard down, West Virginia. You're winning the heavyweight championship of the world. I mean, for crying out loud, don't drop your guard down right now, West Virginia. Keep on doing what you're doing, and absolutely we're going to win this thing against this terrible killer that's disrupted our lives in every way. Thank you again, and God bless each and every one of you.